Yeah, maybe I'll just ask it the opposite way now. Like, so what are things in the report that you wouldn't want us to miss that are like really would change what you would do? Like, is it granulomas? Is it lots of lymphocytes? Is there like
Yeah.
what in a pathology report would cue you to do something very different?
Yeah, I mean, certainly any features that are inconsistent or less consistent with UIP, right? Like if you're seeing granulomas or giant cells or like a significant infiltrate or uh, any sort of um, significant amounts of emphysema, like things that are would be atypical for bland UIP. Those are the things we need to know about because, if you're mentioning giant cells, then I got to go back to the patient and say, all right, what are you inhaling that I'm missing? And if I can't come up with anything, I can't come up with anything. But why are those there when they shouldn't be there for like, garden variety UIP? At least that's my impression. Maybe you can tell me they are supposed to be there, but I don't
And
think.
excuse me, do you find cases where it happens? So, because in my practice, I sometimes say there is interstitial inflammation and giant cells, granulomas, and then the patient has no the exposures and no antibodies. And does this happen?
Yeah, yeah. So all
That
patients have,
the pathologist points towards some etiology, but the patient has not fund for this.
yeah. So all patients have inhalational exposures, right? Like we all are out in the world
Yep.
breathing things in, right? And so the question sort of becomes what's significant and what's not, right? And so if I'm reading a biopsy report or you're reading the biopsy and you're suggesting like it's HP, for example, then I really have to go back to them and say like, what am I missing? What do I think they're inhaling? Sometimes it's a little trickier, like when you're talking about a CTD, right? Because if their labs are normal and they have no symptoms, it can be really hard to make a CTD diagnosis when you guys are describing, significant amount of inflammation, things like that. That can be really tricky. But there's also, these entities where the lungs develop the disease first. And so sometimes you just have to be on the lookout a year from now, 2 years from now, do they start developing joint pains and rashes where you're like, oh, this was, rheumatoid all along, and I just missed it, or just they didn't have those manifestations until later. That's what I
Yeah.
was saying before about sort of provisional diagnosis, right? Sometimes IPF has to be a provisional diagnosis, and then you have to reassess over time what happens.
Yeah.